Good morning everyone. This is Pandya Kumar, a 4th year medical student, and for today's video purpose, I'll be performing pelvimetry. Hello ma'am, this is Pandya Kumar, a 4th year medical student, and today I will be performing pelvimetry on you. This exam is necessary to know if your pelvis is adequate for normal vaginal delivery or not. So we will look at the part of the pelvis first. So firstly, pubic symphysis, pubis, ischium, ilium, then sacrum and its promontory, and at the last we will look at the coccyx. Now we know the parts of the pelvis, so we have to define the true pelvis and false pelvis. For that we have to identify linea terminalis. So linea terminalis is an oblique ridge on the inner surface of the ilium and continued on the pubis, which forms the lower boundary of the iliac fossa. It separates the true pelvis from the false pelvis. Here you can see the linea terminalis, the parts above it and below it. As you can see the linea terminalis, the other part of the body above linea terminalis is false pelvis and the part below it is true pelvis. So now we will look at the type of pelvis in our patient. As you can see, the shape of inlet is transverse oval. The transverse diameter is more than antero-posterior diameter and the subpubic angle is obtuse. It means it is greater than 90 degree. Now let's look at some other types of pelvis. The android pelvis, which is heart shape. The transverse diameter is also more than antero-posterior diameter. The ischial spines will be prominent. The sides walls will be convergent and the subpubic angle will be acute. In anthropoid pelvis, the antero-posterior diameter is more than transverse diameter. The sides walls are parallel and narrow. In platypeloid pelvis, it is flag or bowl-like. The transverse diameter is a lot more than antero-posterior diameter and the sides wall are divergent. Before examining the pelvic inlet, first measure the examining hand from the tip of the middle finger up to the area between the base of the thumb and the knuckle of the index finger. For me, it is 12 cm. Also, before performing pelvic inlet measurement, let's first understand the 3 diameter of pelvic inlet. So, the first one is true conjugate, which is from upper border of pubic symphysis to sacral promontory. It is around 11 cm. The next is obstructed conjugate. It is from midpoint of pubic symphysis to sacral promontory. It is around 10 to 10.5 cm. The next is diagonal conjugate. This is from lower border of pubic symphysis to sacral promontory and it is around 12 cm. So here we have the upper, the middle and the inferior border of the pubic symphysis, and then we have to connect to the sacral promontory. So to evaluate the pelvic inlet, the only way to evaluate is to measure the diagonal conjugate from the lower border of the pubic symphysis to the sacral promontory. So to measure the diagonal conjugate, we will insert 2 fingers into the vagina and then reach for the sacral promontory. And then note where the inferior border of the pubic symphysis touches the area between the thumb and the knuckle of the index finger. And that's how we measure the diagonal conjugate. Now, if the sacral promontory is not accessible, then most likely the pelvic inlet is adequate. However, if your fingers are quite long and you can reach the sacral promontory, then just determine that diagonal conjugate accordingly. If the diagonal conjugate is more than 11.5 as measured from the tip of the middle finger to the area between the base of thumb and knuckle, then it is an adequate pelvic inlet. So now we will evaluate the adequacy of the mid pelvis. For that we will check the sacral curvature first. So this is the sacral curvature. We will check sacral curvature if it is curved or straight, and then we will also palpate the ischial spine in both sides and note its prominence. Then we will measure the bispinous diameter like this, and then we will measure the sacrosciatic notch. They should normally accommodate 2 finger breadths, and also assess the splay of the iliac spine and tuberous bone on both sides. So if the ischial tuberosity or the tubular bone is lateral to the ischial spine, then that is divergent side wall. If the ischial tuberosity is medial to the ischial spine, then that is a convergent side wall. Then lastly, we evaluate the pelvic outlet. So for that, we will keep our fist in between the ischial tuberosity like this, and an adequate pelvis outlet should normally accommodate the 4 knuckles. So as you can see, this pelvic outlet can accommodate 4 knuckles easily, so it is adequate. Then we will also estimate the subpubic angle. So like here it is more than 90 degree. So you can see in our patient the subpubic angle is more than 90 degree. So it shows that it is a gynecoid pelvis. And then we will assess the mobility of the coccyx at the last.